Hi, this is Dr. Sundar, specialist in physical medicine and rehabilitation. Commonly called as Physiatrist and often confused as Psychiatrist, this is a specialty which has always appealed to me ever since I joined it. Of course, when I joined it, even I had no inkling of what this specialty was all about. And this is because physical medicine and rehabilitation was never a part of our medical curriculum, as you know. So when I joined it, it was all new. And I then realized that you could actually divide this into two parts, the physical medicine part and the rehabilitation part. I was one of the earliest to take up PMR in private practice, and I set up a center in South Chennai or South Madras 32 years ago. And I found through my experience that pain management could tide me over for my income and as my career. And I found that rehabilitation, my training in managing people with disability, would be a beautiful area where I could express my social commitment. So in 1997, I started the Freedom Trust. Essentially, it was for people with disability who couldn't afford the rehab procedures or the appliances, or couldn't come to the city where people like me or the rehab team were available. So what started as a very small trickle has now become a very big movement, and that is what I would like to talk to you all about, and that is the social relevance of a physiatrist. When you join physical medicine or rehabilitation, you would probably have some idea of what it would be as a career, and that would be to use physical methods of treatment, which of course you will be handling through the physiotherapists or the occupational therapists who would be handling your patients, and that would be only part of what your training is, and the other part being handling persons with chronic disability. Now, the social relevance of this specialty cannot be underscored too much. Of course, every doctor has this feeling or this urge in him to contribute to a social cause. Mostly it is his or her training that enables him to contribute to this cause. And as a physiatrist, I have realized that through my Freedom Trust, there is so much more a physiatrist can do to society, primarily because of his or her skills during the training. So my dear friends, when you take up a course like PMR, you must also keep this in mind, that you can plow back to society what you have learned. I must say with a certain degree of confidence and happiness that our trust has grown to doing over 100 camps every year, and in remote areas there is no state in India that I have not gone through my trust. We provide artificial limbs through a concept called Walk India, and we provide calipers and splints and other mobility aids through our Gram Viklang Punarjanmam concept. The idea is that a very skilled team with the physiatrist can assess these persons with disability, I won't call them patients, and whether they need a splint, a walking stick, a walker, a tricycle, an artificial limb, a cosmetic hand, whatever the need is, I have been able through my trust to provide them free of cost. Now this cause is very common. You could align yourself with several of the organizations that are in this area. But let me also say that whereas so many organizations are in this field, you will make a difference with your training and with your empathetic approach. Does this patient need this artificial hand? Does this patient need a splint? Does this patient, I won't call them patients, does this person or child need a mobility aid? You would be able to assess and give back to society based on your training. I wish you all the best in your career. If you take up PMR, I'm sure you'll feel a more fulfilled person as I have been. Thank you.